Yesterday, one person died, and today also one person died.
Today is the 5th day of the doctors' industrial action, and when the Medical Association called for a press conference, everyone wanted to hear what they had to say, especially now that the press conference was only coming in hours after the minister had directed them to return to work. And then came the announcement, the one that no one wanted to hear.
The doctors' fraternity have considered escalation of the industrial action. This is the adverse effect that we risk by employing strategies which instead unleash the wrath of the medical fraternity. The doctors are considering immediate withdrawal of emergency health services.
Dr. Ekwaro Oboko says it is unfortunate that the ministry praises the doctors on duty as their own, yet the association at the start of the strike resolved to have emergencies attended to.
Doctors you see there, whom the Ministry of Health is saying they are patriotic and are working, those are our doctors whom we have deployed to provide emergency services.
The Uganda Medical Association also scoffed at the Solicitor General's letter dated 9th November that labelled the association and its activities illegal.
Order to go back to work stems from the fact that their industrial action is illegal.
Legitimacy is more important than legality. You may be legal, like the Medical Workers Union, but lack legitimacy. If the Uganda Medical Association calls for industrial action for doctors and nurses, clinical officers, and other health workers follow through, disobeying their leaders, it means their leaders have lost legitimacy.
They were concerned that the Solicitor General's letter was exalted by the Minister of Health, Dr. Jane Ruth Acheng, who is a subscriber of the Medical Association.
Dr. Jane Acheng is a member of the Uganda Medical Association. Her number is 1022, and she renewed on the 7th of September 2017 when she came as the chief guest of the second Grand Doctors Conference.
The doctors now vow to stick to their 4 major objectives, including bettering the working conditions of intern doctors, streamlining the employment of senior house officers, availability of medical supplies, and welfare of doctors across the country.
As medical interns of the year 2017-2018, we put several demands on table. One was that we are tired of working under poor conditions, of no materials, no supplies. 2.
In the meantime, doctors will sustain their strike and threaten to escalate it even as consultations with key government offices are still ongoing. The Uganda Medical Association is expected to seek audience with the president on 17th November, and it is then that a decision will be taken on whether to call off the strike. Zahara Namuli, NBS, Live at 9.